Thanks for watching Afternoon Live. Addiction often comes with other physical or mental health challenges, so it's important to treat the whole person. Here to share more about the importance of integrated care, we welcome Editor-in-Chief of Integrated Health Magazine, Dr. Ronke Komolafe. Thank you so much for joining us.
Thank you for having me.
So let's talk about how we define addiction in the first place, because we understand a lot more now about how it really changes how our brains work.
Yes, addiction is a chronic disease that involves a disorder of the brain. And oftentimes the chemistry in the brain changes when you have addiction. Addiction often comes about because individuals using substances or have behavioral problems and not able to manage this on their own without help.
Sure. So there are different types of addictions. You mentioned substance versus behavioral. What are some things we can look for in our loved ones if maybe we're concerned about an addiction issue?
When an individual is taking controlled substances and they have absolutely no way of controlling their behavior, and as a result, it turns into a harmful situation where they're harming themselves, their health, or other people. This is a big sign that there's an addiction problem. We often see behavioral addiction come across in form of OCD or eating disorder like bulimia. Oftentimes people know things are going on, but they have no way of being able to control this. So typically we have two types of addiction: substance use disorder addiction and behavioral addiction.
So tell me more about this idea of integrated care and how it can be so beneficial to take a more holistic approach.
So integrated whole person care focuses on treating mental, physical addiction and social health simultaneously. The goal is that when you're treating an individual, you go to the underlying root causes of what's really going on. So let's take, for example, an individual with alcohol addiction, for example. We often know that people use alcohol to control and manage some mental health conditions like anxiety or depression. So in a situation like that, you do want to treat the mental health diagnosis simultaneously as the alcohol disorder. And we often know that individuals who have chronic alcohol use often end up having some type of liver condition, which often results in physical health diagnosis. So having the primary care doctor, having the mental health doctor, having the specialist all come together simultaneously, creating a treatment plan in collaboration with the patient often leads to better results. Because when that happens, the underlying root cause of why that individual is using is being treated. And other simultaneous symptoms that tends to cross over are also being simultaneously addressed.
Okay, what can people do if they have a loved one that they're concerned about in terms of reaching out and finding care? It can be kind of tough to navigate those situations.
Yes, when it comes to addiction and trying to find whole person integrated health, understanding the symptoms really matters. Understanding that this is a chronic brain condition, understanding the type of mental health condition the individual has, and then working with your prescriber to make sure all the doctors are talking. So making sure that you have a patient portal if you have access to technology, making sure that the medication are all working together, not against each other, making sure that the labs are being exchanged and the doctors are speaking, and making sure that as a family member or the patient, that you understand the overlapping symptoms between physical, mental, and addiction diagnosis. In some cases, depression diagnosis may push an individual who has alcohol diagnosis, for example, to drink more, leading to more physical health conditions or more addiction conditions. So understanding the symptoms and the triggers is the best way to be able to help an individual.
It can be a lot to manage, but there are so many wonderful people out there to help and who are offering these services. And we really appreciate your time. Thank you for stopping by and chatting with us today.
Thank you so much for having me.
We'll have more about Dr. Komolafe on our website at katu.com. We'll be right back with more Afternoon Live right after this.